Joining me live is Professor David Coghill, President of the Australian ADHD Professionals Association and Professor of Child and Adolescent Psychiatry at the University of Melbourne. David, thanks so much for joining us. We just saw some examples there of how not having ADHD medication can impact people. Do you have any other concerns?
Well, I mean, it is very concerning when people can't get the medication. One of the problems is that some of the solutions that have been suggested by the pharmacists, for example, are really not practical. So we need to, but it's very difficult for patients to, or people with ADHD, to be able to get back to see a specialist. So I agree that we need to make sure that we've got as little red tape as possible, but also we need to make sure that patients get safe treatment.
And what if ADHD is left untreated, regardless if people choose to take medication or not?
Not treating ADHD is a bigger risk. Untreated ADHD leads to huge difficulties, not just for those people with ADHD, but often for those around them. We know, for example, that ADHD costs Australia $10 billion a year in lost productivity. So you can imagine the impact on the workplace if ADHD isn't treated.
A recent Senate report has called for a nationwide framework to look at ADHD as, quote, a public healthcare emergency. 15 key recommendations were welcomed in November last year, as you well know, be the president of the Australian ADHD Professionals. What are some of these recommendations?
Well, we asked them for a national strategy, and that is one of the recommendations that's there, a national framework for ADHD. Also, improved consultation, both with people with lived experience and with professionals, so that we can actually identify better ways to support people with ADHD. One of the big problems that we have is access to care. It's very expensive and actually very time consuming to wait for an appointment for ADHD. So I think thinking about how we fund the healthcare for people with ADHD to make it easier for them to access affordable healthcare, and also to increase training. A lot of professionals, healthcare professionals who are being asked to manage ADHD actually aren't confident. They haven't had core basic training. And so one of the things that the inquiry asked for is for better education. And certainly ADPA, our Australian ADHD Professionals Association, is really keen to be able to action this alongside the other recommendations. We've been asking for an opportunity to discuss this with the health minister, but as yet we haven't been able to access that opportunity, and we're not yet clear about what the government intends to do about the Senate inquiry.
And do you think we need to look at changing the way we teach students at school and perhaps how we support people in the workplace?
Well, I think we do need to change the way we support students at school, not just at school, but at university and all other educational environments. In order to do that, we also need to be able, I mentioned about educating healthcare professionals, but also educating educators. Many of them have not had any training. In the workplace, as I said, $10 billion a year is the cost to Australia for lost productivity in the workplace. And so we really need to work with employers to think with them about how they can better support people with ADHD in their services.
ADHD can often be stigmatised as not being a real condition. What would you say to those comments?
I'd say it's a very real condition. If we look even at the extremes, having ADHD, where the diagnosis is missed until adulthood, increases the mortality rate, the chance of dying, 4 times. It costs Australia $20 billion in total. It leads to increases in substance misuse, increases in criminality. All of these are, if not avoidable, can be really very much ameliorated by effective treatment. ADHD is real. It impacts not only on those who have to live with it, but also on Australia as a society.
And you mentioned ADPA. For more information, people can head to that website, aadpa.com.au. Thank you very much, Professor David Coghill, for your time and expertise.
Thank you, Jaynie.